Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you take your practice to the $2 million mark and beyond. I got a question one of these days or recently from Sarah. Sarah has been using successfully laser she does 6 treatments for $700. And she recently got a radial shockwave machine, and she's having a little bit of a challenge transitioning from laser to shockwave therapy and kind of how to charge for it or what to include in it and things like that. So I don't really know exactly what laser she has. She may have like an MLS laser, or she might have like a Remy laser, but I think they're both about the same. I think that price is about right. 6 treatments for $700. And I think what I would recommend, the easiest thing to do is if you have a radial shockwave, I would do shockwave, and if it doesn't take you that much time, I would do shockwave and laser. I would just add it together and say, this is my regenerative package. So you can have the best of both worlds, and then you take the price and you increase it from 700 to 1,500 or something like that. So this is what I do. I charge $250 a session. So $250 a session would be about 1,500, and then that you would just include the laser. I wouldn't offer the laser separate. This is just what I do. Because her concern was complexity. And I always say, well, I'm going to give you the best treatment, which would be the combination of both of those. What I currently do is I do radial, I do focused, and then on one of my offices, I have a Remy laser, so I just add on the laser. I don't charge additional for it. And I don't really see too big of a difference with my improvement with it. She asked a couple of other suggestions. She said, well, could I offer Shockwave at a lower cost with their office visit? Now, some doctors, they have a hard time saying the price for Shockwave, which I say it's $250 a session, and they would prefer to do an office visit and just discount it. Let's say you get $100 for the office visit, so maybe you do it for $150. I've thought about doing that with certain things such as Swift as well, where you could just you would say that in an office visit and they charge you like $100 for the tip or something like that for a tip charge. I've thought about doing that as well. I'm not doing that. What I feel like is that if it's a real office visit, it's an office visit. So I do an office visit the first time. I do my night splint foam rolling morning stretch. They come back in about 3 weeks. That's the time I do the ultrasound. And if I see thickness in the plantar fascia or any other areas that I'm dealing with, any of the other tendons, there's effusions within the tendon fibers have changed a little bit, and I can see that comparing right side and left side, then that is what helps me determine that the Shockwave is the best treatment for them, and it works really, really well. And so that second visit, when I see them, I'm going to do the ultrasound. I'll do an office visit for that, and then if I have time, I'll do the Shockwave that first day. So they get an office visit, that established patient office visit, and then they're going to get the first Shockwave session. The other 5, I do 4 of them without office visits. I do them weekly, and then the last one, the 6th one, that one, since I have a graduation Shockwave page I give them, or like the last Shockwave page, and what that does is that goes over what the plan is next, meaning they're going to see me in 6 weeks. If it doesn't work, either physical therapy, we're going to do another ultrasound or an MRI, or we're going to do something else like that. So having that whole plan, I believe, constitutes an office visit for the last one. Now, would every single time constitute an office visit? I don't think so. So that's why I don't do it that way. Sarah also had a question about doing Shockwave every 2 weeks. I do know. I was talking to one of my friends, Paul Hobro. If you don't know Paul, he's in the UK, and there are some docs there that do Shockwave 3 sessions every 2 weeks. So every 2 weeks, 3 sessions. There's not really much written about doing it every 2 weeks. I think the reason they do it is because by the 3rd session they're starting to feel better, because you're at week 6 and you're only doing three sessions versus the 6 sessions that I do. But for Sarah, since she's already doing the 6 sessions like the patients are used to do it, you would just add the Shockwave, you would do the Shockwave. Or if I could do it over again, I would actually have a staff. I would train a staff, be with me, feel real comfortable. They would do the Shockwave, they would do the laser, and then basically I would just offer those packages to the patient. One of the things that really helps, which Sarah did, is she purchased a ultrasound, And this ultrasound really helps for helping patients to decide about doing Shockwave, because many times when you look at the area, you don't see the tendinopathy unless there's like a bulbous change to the Achilles or something like that. You can't tell there's thickening to the plantar fascia unless you look at it with an ultrasound or an MRI. I find the ultrasound's a lot cheaper. In Massachusetts, your concern was covered by insurance. We had kind of a snafu here in Massachusetts. So Massachusetts Medicare, it gets covered, and so Medicare, there's no issue. Ultrasound guided cortisones, things like that, or ultrasound guided other injections. Usually I'm doing not so much cortisone. I'm usually doing more like joint injections with ultrasound. But other insurances, many times they don't cover it. One, for example, if we wanted it to get covered by Blue Cross Blue Shield here, we would have to become like a certified ultrasound, almost like technicians, and we would have to be almost like not a board, like a certificate or a certification for us to do it. And for us, it just wasn't worth it because we had to present so many cases. So we opted not to do that, and we're okay just charging. So we charge $100 per foot for the ultrasound, and then I usually charge once. I don't do repeat charges. So meaning I would do it once for them, let's say for the right plantar fascia. Now, if I'm just looking at the left, it's not hurting them, I'll do the left one as well, and I'll just show them more as a comparison, but I only charge for the right. If both of them are hurting, I'll charge for both, which would be $200, but then I don't charge additionally to do any other ultrasounds for that patient. So that's kind of what works for us. And so I really don't have an issue. I usually do that at the second visit for most of my patients. First visit's x-ray, second visit's ultrasound, and then we make the plan. For many patients, it is the Shockwave. So just to complete, I would say if you're already doing laser and you have time to do both of them, I would add them together, because I think if you separate them, it's going to be too confusing, because patients aren't going to know, should I do laser for $600 or should I do Shockwave for $1,200? Well, just put them together and just say, this is our regenerative package. What I do is I just put the Shockwave is this much, and I just add on the laser, and I don't charge them for the laser because I don't have a laser at both offices. So that's how I do it. So once again, hope you guys find this beneficial. If you need help implementing this in your practice, some people are struggling and they reach out to me, shoot me an email, see if it's a good fit. I can kind of help you implementing some of these things in your practice. Okay. Once again, we'll talk to you soon.